Good morning, I'm Kevin Yingling, to some Dr. Yingling. I'm the CEO of Mountain Health Network. Due to COVID-19 challenges, I am unable to meet with you all in the employee forums, which I would feel much more comfortable about, and it would be easier for me to communicate. But today, we've decided to provide a video to allow me the opportunity to express myself more clearly to each one of you. I so appreciate everything that each of you has done during this second surge challenge across our community and within our healthcare network. It's been a very big challenge. And when our community needed you, needed us, you were there. And I appreciate everything that everyone has done to meet those needs. This will allow me an opportunity to share with you about the future, about how our strategies for Mountain Health Network moving forward are being implemented, and to share with you some of the results of the employee survey, which I find to be very positive. You expressing to us how you feel about what's happening within Mountain Health. I would also like to share a few minutes about myself. I think that's important so you understand who I am and why I've chosen to take this current course in my professional journey and my life journey. I'm a servant leader. I've learned over the years that it's best for me to serve those people as a leader, and I look forward to doing that for Mountain Health. Really, this started very simply for me. I was thinking about what my career choice would be, and I realized that in healthcare, I can make a difference in other people's lives. I believe that's why you've chosen to be part of Mountain Health, is to make a difference in people's lives. It was simple at first for me to choose a healthcare career in pharmacy and then medicine. I realized early on that in order to make a difference in people's lives, you had to work with people that wanted to make a difference in people's lives. You had to work in a place where the philosophy was, we're going to make a positive difference in people's lives. You work in an institution that wants to make a positive difference in people's lives. That's what you do. That's why I serve as your CEO for Mountain Health Network. We are here to serve our community. And you know, when I say our community, on one hand, I can think about 23 counties and hundreds of thousands of people, but to speak about this factually, it's really your family, your friends, your communities for whom they are seeking health care, and we provide excellent care to them. It's my family, it's my patients even, that are seeking care within our network, and we will provide advanced medicine and compassionate care for each one of them. My wife and I returned here more than 30 years ago to raise our family and for me to seek a professional journey that I thought would be important and satisfying. And that part of the journey has been excellent. Just like you, we wanted to raise our family in this community. We wanted to seek out all the resources that this community had. And fortunately, I was given a pathway to pursue professionally in which I could make a difference in people's lives. Now, I plan to work seriously and consistently to do that at Mountain Health Network, working with fine people like you. We look forward to the future here in Huntington and with Mountain Health Network. It is an excellent opportunity. I look forward to serving you, and in particular, serving the patients so that we can bring high quality services to them in every aspect that they need help. I assume they need help with their health care. I would like to review some of the accomplishments that have occurred in the last several years as Mountain Health Network has continued to grow. First, I'd like to highlight the accomplishments and achievements of the Hoops Children's Hospital. Our efforts there have been extraordinary. Unifying care for children in one place, one geographic place, has been a real opportunity to provide advanced medicine and compassionate care to that sometimes very vulnerable population. Advancing care there includes bringing specialists, pediatric specialists to our community, pediatric specialists in nephrology and infectious disease and many other specialties of pediatrics. Advancing services that we've had before, such as pediatric cardiology. Establishing programs, training programs in graduate medical education around specialties of pediatrics that really is going to advance the care that we provide to children across this region. Providing them specialty imaging services within our platform is another important area that has been valuable across our region. And again, I believe we will be recognized as a leader in pediatric care across this region. I would also like to highlight the Center of Excellence established in cardiovascular diseases at St. Mary's Medical Center. This is also going to, I believe, catapult us forward regarding the services that we can provide to patients in need of cardiovascular services. The advancements of intravascular ultrasound and intravascular interventions has just been phenomenal to improve care of our patients. The advancement in areas such as congestive heart failure. There is a significant burden of illness around what we call the cardiomyopathies, the poor functions of the heart because of various diseases. And we have experts now in our Center of Excellence, like Dr. Rueda, who will advance the care of these patients going towards the future. This will be an exciting time as we advance the Center of Excellence in cardiovascular diseases. One of the other areas I'd like to highlight in sharing with you is that we have a very important responsibility, and we seek to meet that responsibility every single day. Each one of you is an important member of the team that advances the quality and safety of our patient care throughout the entire network. It's very important that each one of us focus on that. We need to be a reliable organization to address the needs of our patients. We have significantly changed the pattern of illness that is acquired at times while a patient is hospitalized. Catheter-related illnesses and other types of events that occur occasionally while a patient is in hospital. Preventing falls, making sure that catheters are removed in a timely manner so that no infectious diseases occur. We have bent the curve on that here at Mountain Health, and we will continue to be focused on that, with each one of you being an important part of how that's done. Every small effort that you make makes it that much clearer that we are going to address quality and safety for our patients every single day. There are some outstanding new projects across our institutions. I'll identify a few of those. First, at Cabell Huntington Hospital, we have understood the flow dynamics in our emergency department, which is never more stressed than it has been recently through the COVID-19 surge. We identified that there needed to be more rooms, more spaces, more observation beds. So Cabell Huntington Hospital has moved to change its footprint around the emergency department, establishing more observation beds, establishing more emergency room beds in order to meet the needs that our patients have. We have established ourselves through emergency services as the place to arrive for emergency care. And that need is increasing and increasing. And it's really good that we've been able to expand the footprint to meet the needs of our patients at Cabell Huntington Hospital. In addition to that, we have had other opportunities to expand care at St. Mary's Medical Center. We now have the region's accredited sleep study program all in one unit, all to the advantage of our patients. For many years, I've referred patients for sleep studies and found it unique to try to figure out where to send those patients, why to send those patients to a certain place. Now we have one unified center staffed by excellent physicians and staff in order to meet the needs of our sleep patients, sleep medicine patients from this entire region. That's very exciting. We look forward to other expansions at St. Mary's Medical Center, such as the retail pharmacy that's now about to open on that campus. Cabell Huntington Hospital and its employees have enjoyed a retail pharmacy for their convenience and for their needs right on campus. And now St. Mary's Medical Center will have the exact same service. That will be really important to each employee and each staff member at St. Mary's to be able to receive their medicines in a timely manner through that pharmacy. In addition to that, the retail pharmacy platform, which will unify the pharmacies of Marshall Pharmacy, the pharmacy at St. Mary's and the pharmacy at Huntington Internal Medicine Group, will be an incredible platform to advance services and care in retail pharmacy and ambulatory pharmacy for our patients. I am so encouraged and look forward to working with the staff and the folks in those areas to expand that platform. It will also allow us the opportunity to vertically integrate pharmacy services within the hospitals. So important programs that have been established, for instance, at Cabell Huntington Hospital in the Meds to Beds program, providing medication to the patient as they're leaving the hospital so that there's no lapse in adherence or compliance. That will be a platform that we can grow at St. Mary's Medical Center and advance care, decrease readmissions. It's really going to help to affect a real difference in the quality of care for those patients discharged from St. Mary's Medical Center. We're also interested in growing for the future. I understand that in the midst of a COVID challenge like we have right now, with stresses on the system, including how we pay for the services that are necessary to staff our hospitals properly, how can an organization be looking to the future? And yet, we have a responsibility to look to the future. We have a responsibility to understand what are the needs of our patients in the next few years, not just in the next few days. And from that, it's clear that we need to grow and expand in a variety of ways. Some of those are going to be, for instance, establishing graduate medical education programs in important areas that will provide physicians for the future. For instance, establishing a gastroenterology fellowship, raising up the next generation of gastroenterologists to meet the needs of our community. As I've already mentioned, perhaps it's in areas of growing programs in pediatrics or in cardiology that would also advance the care of our patients in the future. We are investing in those so that the future would be even brighter than it is today. In that same vein, we also need to establish new facilities. One of the outstanding opportunities that will be provided to us is through the building of the medical office building on the campus of Cabell Huntington Hospital, a 5-story building which will bring state-of-the-art services in neurology outpatient testing, in gastroenterology and physical therapy. We look forward to that building being open in 2024 and being able to provide advanced medicine in a compassionate way, in an efficient way, in a highly reliable way for our patients in the future. And I look forward to those of you who are listening today that would be part of that program as it expands. But it is an important part of an organization to be able to, if you will, look over that mountain and see what is needed for our community and begin to build for that, even though in the near term, we have many stresses, and those stresses have to do with staffing and finance. And I understand it seems a little paradoxical, but not really. The leaders of the organization have to be able to build for the future, to meet the needs of a growing regional network, to meet the needs of our patients. And we are very encouraged by that opportunity. I'd like to take a few minutes to share with you the outcomes of the employment survey that you also generously participated in. And I appreciate each one of you who took your personal time to fill out the survey and express your thoughts and opinions. There are some really important things that have come out of that. But probably first and foremost is that I so appreciate you directly communicating with us. It's really important. Just as I'm working to communicate with you all today and wish it was in a more personal way, surely I would be more personal if you could fill out that survey and express to me in real time exactly how you felt. But we have looked at those surveys, and I look forward to working with those results to move the culture of our organization forward. The culture of an organization is really important. How you and I work within the environments of care, how we think about that, the mindfulness that we have about what we do every day, that's really important. And I was so encouraged by some of the results that you all provided. I'm going to actually look at them and make sure that I get them right. The first is that you felt that you were more involved in the decision-making process than you'd had been in the past. That is so important. It is so important for you to understand that we take your opinions seriously. We look for the common thread that occurs when the employees and the staff give us feedback. And we take that not only to capture it, but to understand it and then utilize it to move forward. The fact that you feel more involved in the decision-making process is a real positive for us. Another thing that you expressed was that that you felt that the hospital felt more like a family. Now, I got to tell you, I was pleased to hear that. In these times, in COVID times, with all the stresses, with all the dynamics, with both the frustrations and the human dynamics of the illness that COVID-19 has brought upon our patients, to understand that you feel that we function as a family or function more like a family, that is incredibly important to us. I think when I think about trying to make a difference in other people's lives, you do that from a family orientation and a culture that fosters that. And I look forward to growing that based on the results of the survey. So I appreciate your willingness to watch this video. Please be assured that for me, communication is vitally important. Another thing that came out of the survey was your concern about staffing. I understand. Every single day, often twice a day, I hear about the staffing challenges within the hospital. Every week, I hear about the staffing challenges of the hospitals across West Virginia. Every day, I read about the staffing concerns that smart people like you have about how the work gets done inside of our hospitals. It's on the agenda every single day. It is a difficult challenge. I understand the human dynamics of this. I can understand the aspects of burnout. I understand the aspects of the difficulties of patient care. Having worked in these hospitals for 30 years, I understand that. I also understand how important it is for us as an organization to meet your needs, to understand the financial dynamics that you're feeling, to understand that there's attractive things outside of our community where you could practice. I understand those things. I will work diligently to meet your needs. I will work diligently to meet the hospital's needs. I will work diligently that as we get through this surge, that we will establish an organization that's highly reliable, that begins to meet the staffing needs in a deliberative and consistent way to provide care to our patients, to provide advanced medicine, and compassionate care in a systematic way to every patient who seeks care from us. I look forward to addressing those needs. It's a challenge. It is a real challenge. And I appreciate your concern. And you can understand that I hold that concern deeply, and we will work on that diligently. I would now like to take a minute to just personally recognize you, the staff, the employees, the nurses, the physicians, the people in the front office and in the back office, the people that do every part of the work that needs to be done to make a difference in people's lives at Mountain Health. You are very important, and your work is deeply appreciated. There has been no challenge as broad, as deep, as difficult as these last few months have been. I've been in medicine for 30 years. I was present when there were the challenges of things like human immunodeficiency virus, Ebola, other types of challenges to the healthcare system. None has been like this. I sincerely appreciate your dedication, your reliability. When our community needed care, you were there. You were reliable. You were consistent. I appreciate that. The future will be challenged. This COVID surge is not yet over. I am encouraged that I see the numbers declining. I am encouraged that we're beginning to look to the future of 2022 and the opportunities that would bring. But today, I really want to express my appreciation to you. You know, you are our heroes. Our community sees you as heroes. The workers in our organizations look to various places within our organization and identify heroes within our organization. I identify you as heroes of providing reliable, timely care again and again and again. The difficulties of this second surge have really stressed us. They've stressed us not only institutionally, but they've stressed us as individuals. Your resilience has been more than commendable. I so appreciate that. I would want you to know that every time we make a decision about trying to address compensation or incentive or any of those areas, potentially even a bonus for trying to appreciate you, what I'm really recognizing is the everyday, consistent, reliable people who do it again and again to advance medicine in a compassionate way for each patient we serve. I appreciate the opportunity to be able to share with you. I look forward to a day when we can share in person. I hope that this day is a good day for you. Thank you for your time.